Video 2, Bloodborne Pathogens. Bloodborne Pathogens Standard also goes hand in hand with the Needle Stick Safety and Prevention Act of 2001. We did talk a little bit about Bloodborne Pathogen Standard in the last video, and we will be talking more about the specific diseases and how we can come in contact with them from blood or other OPIs. Hepatitis is a disease that's characterized by inflammation of the liver. Hepatitis A and E are spread by fecal contamination and are not bloodborne pathogens. Hepatitis B, C, and D are bloodborne. Hepatitis B and hepatitis C pose the greatest risk to workers. Hepatitis B statistics. Up to 2.4 million people are chronically infected. But out of this 2.4 million, about 1 in 2, or 50%, do not know that they are infected. Hepatitis B symptoms can include fatigue, abdominal pain, loss of appetite, a yellowing of the skin or eyes, which is called jaundice. Some people have no symptoms, but it can lead to chronic liver failure and death. Hepatitis B is contagious. It spreads through contact with infected blood and bodily fluids, mother to fetus, tattoos and piercings, through sex, and through injection drug use. Hepatitis B does have a treatment, a very effective vaccine. Some people get it when they're kids. Some people, like me, had to get it as an adult. It's a series of 2 to 3 injections. You must get tested after you've had the vaccine to make sure you get immunity. This test is called a titer test. Some people don't respond to the vaccine, and if you don't know if you're a responder, you could be at risk. There's also antiviral medication, interferon shots, or a liver transplant. Hepatitis C statistics. Hepatitis C is the most common type of viral hepatitis in the United States, affecting 4 million people. 20% of those people do not know that they are infected with hepatitis C. Hepatitis C symptoms can be dark urine or clay-colored stools, feeling tired, joint pain, loss of appetite, that same yellowing skin or eyes called jaundice. Some people have no symptoms, and it can lead to chronic liver disease and liver cancer causing death. Hepatitis C is contagious. Like hepatitis B, it's spread through infected blood and bodily fluids, mother to fetus, tattoos and piercings, through sex, and through injection drug use. Hepatitis C treatment. There is no vaccine for hepatitis C, but in the last decade we have discovered an amazing treatment, and we can actually cure more than 90% of cases with direct acting antivirals. If someone did not respond to these medications, the other treatment would be possibly liver transplant. Human immunodeficiency virus. 1.2 million people in the US have diagnosed HIV. 13% of people living with HIV do not know that they have it. Human immunodeficiency virus leads to acquired immune deficiency syndrome, or AIDS. Symptoms are night sweats, flu-like symptoms, swollen lymph nodes, mouth ulcers, and skin rash. HIV is contagious. It spreads through contact with blood and other bodily fluids, mother to fetus, tattoos and piercings, through sex, and through injection drug use. How do we treat HIV? We have more tools than ever. HIV does not survive well outside of the body. If someone is infected, they're infected for life, but they can have it completely controlled with medication to the point that they don't have any virus circulating in their system. If someone thinks they are going to get in contact with HIV, they can get on PrEP, pre-exposure prophylaxis. If you were exposed to HIV at work, you would go to the hospital and get post-exposure prophylaxis. This is an antiretroviral therapy that will stop the virus. Additional infectious diseases could involve viral hemorrhagic fevers like Ebola. This can be very scary, but if this were to be in a patient, most likely they deal with it at the hospital or through the CDC. Generally, if you're involved in it somehow, there's no handling or washing. It goes directly to cremation or in a sealed casket if medical devices may interfere with cremation. Creutzfeldt-Jakob disease, or CJD. This is caused by an infectious agent called prions. Prions are not viruses and they are not bacteria. Prions tend to exist only in the brain and the spinal cord tissue, and you have to come in direct contact with them to be infected. These bodies may not be autopsied the same, and if there is treatment, it would involve disposable instruments, special sheeting to catch fluids that would be disposed of after any preparation. But this may also be something you'd have an advice on from the medical facility. Lastly is the gastrointestinal infections. This brings us back around to hepatitis A. Also, there's salmonella, E. coli, or C. diff that can be in the intestines of the deceased. If any of that leaks out and you get in contact with it, especially if the patient died from this, there may be high concentrations and they can cause infectious disease. But in the next video, we're going to talk more about the standard precautions, how we prevent all of this from happening. So I'll see you at video 3.